Hello, everyone, and thank you for your time today and joining us as we're here to welcome our carrier partners to present the details and the sweet spots of their plans. My name is Christy Strauss, and I'm a broker sales manager at IAD. Those of you who are new to IAD, we are a full service FMO with a national footprint. And really, what that means is we're here to provide you opportunities to grow your business with our unique agent sales perks program. So just give us a call to learn more about that or visit us on our website, www.iadbrokerage.com. This is a virtual and our first sales summit. We will be recording this, and the recordings will be available in our YouTube video library, as well as on our social media pages and eventually on our website. So let me just kick this off to get started. Our first carrier partner is HAP, and today we have Dustin Van Wine that will be presenting the HAP program. So Dustin, go ahead and take it from here.
Good morning, everyone, and thank you for having me today. Super excited to be joining you and talking about the 2021 HAP products. We're very excited to be talking about our products this year. I think we have some excellent new changes for 2021, so I'm going to be going through that. If you have questions, you'll get all my contact information at the end, and we can also make sure we get you a copy of the presentation. So, start off, I'm going to be talking about why HAP, our 2021 Medicare Advantage plans, our Medicare Advantage supplement benefits, Medigap plans, additional resources, and how to get certified with HAP. So to start off, HAP is a nonprofit. We are owned by Henry Ford Health System. What this means to you is we are not traded on a stock exchange. We do not have shareholders. When you are traded on a stock exchange, your shareholders have to be your most important client. If the shareholders are not happy, your stock prices fall and you have a bunch of issues. This means when looking at our plans compared to those stock-owned companies, you're going to see that the plan benefits are a lot richer. We don't have to make the huge margins that those share-owned companies have to make. So I think this is something extremely important to our members. We are integrated, as I mentioned, we are owned by a hospital, which means we get information back and forth between the medical and the insurance side. So you're basically getting both sides. So when our members are with us, we're able to talk to doctors immediately, find out exactly how to work with them more closely. As new medical information comes out, we're kind of the first to know about it. We're also local. We're right here, owned and right here in Detroit, Troy, Flint, Grand Rapids, and we're hoping to open a location in Kalamazoo as we expand. All of our employees are local, which means all the money is invested right back here in the Michigan economy. Let's talk about our service area. So our service area for 2021 is expanding. So here is a map. It's kind of hard to see it, but we are going to be expanding to 7 new counties. That includes Barron, Branch, Calhoun, Cass, Kalamazoo, St. Joseph, and Van Buren. In those 7 counties, we'll be launching one plan as our best-selling plan, our 015 HMO. In those 7 counties, there's 3 major hospital systems. So we have 2 out of the 3, Lakeland and Bronson. So pretty excited about that product launch. Our DSNP is expanding also to 3 new counties. So our DSNP will be in Macomb, Oakland, Wayne, and we currently are in Genesee County. Our Kent, Muskegon, Ocean, Ottawa counties and Teal there, we've been very successful there. In our product launch this year, we had an agent sell over 700 apps new for January 1st. And we had another agent sell 500. We're expecting that to continue into 2021 as we work very closely with the Phinia or Mercy Hospital system there. So definitely looking to grow more in the Grand Rapids area. We are also adding our travel benefit to our PPO plans. So our PPO clients will now have basically a national travel benefit on the plan. Let's talk about our plans for 2021. So as I mentioned, we are expanding in the Kalamazoo area on our plan 015. This is our most successful plan. It's about 73% of our sales. I think that'll change a little bit for 2021 as our PPO includes that travel benefit. But this has been a very successful plan because it is extremely rich. So we will be in 37 counties for this plan. This plan does include our travel benefit, which is Arizona, Florida, Texas, and kind of the northern Michigan area. We've been doing the travel benefit for 3 years. I know some carriers introduced it this year and have kind of really struggled with doctors. It took us a couple years to figure it out, but now that we've been doing it for 3 years, we've figured out the travel benefit. We figured out how to work with the doctors, and it's been pretty successful for our clients. Embedded preventative dental, vision, hearing, fitness over the counter. We also include 2 preventative dental cleans on all of our plans. This plan includes tier 1 and tier 2 drugs at a 90-day mail order at a $0 copay. New this year, really excited that we will have tier 6 drugs at a $0 copay. These are Part D vaccines, so one of the first carrier doing this. And our plans, for the most part, do not need referrals. If you look at the benefits here, it is an extremely rich plan. So no premium, no medical deductible. Inpatient hospital, I want to point this out. We're seeing a lot of carriers go above that $300 mark for the inpatient hospital. We did a ton of studies on inpatient hospital copays with agents and members. And the one thing we heard continuously is what clients are willing to pay for when it comes to an inpatient hospital copay. And we kind of heard that magic number of $300 is kind of the cap. So we were able to keep our plans below 300, all of them. We're probably one of the only carriers doing this, but 295. PCP on this plan is $0. Our ER and urgent care copay is inclusive. What this means is if you go into an ER facility or urgent care facility, everything done in that facility is covered under one copay. We've done this for years on all of our plans. I know a lot of competitors are trying to copy this, but it's one thing to try doing it and actually getting the doctors on board. We do see a lot of carriers that their clients are hit with multiple copays. So, for instance, you go in the ER, you need stitches, you need x-rays, you need ultrasound, lab work, you're hit with multiple copays, where at HAP you are not. Our labs, diagnostic labs, are a $0 copay. We do give you the over-the-counter benefit. This plan is $75 per quarter. Part D deductible. We're the only carrier that I'm aware of that on all plans, every single plan, we have no Part D deductible for any tier. One thing we continue to hear from agents and clients is that they go to pick up their tier 3 or 4 drug and they're hit with a $100 deductible on top of the copay or co-insurance. So really excited that we've continued not having any Part D deductible. Our next plan is our primary choice plan. This plan has also been pretty successful. This plan was actually one of the first plans ever to be designed by doctors. So we actually, in I think 2018, worked with a group of doctors, part of the United Physicians Group in Troy. They're one of the largest physicians group in Michigan. And we actually worked with them to find out what them as doctors think their members want. And so they actually designed this plan for their members. It's a pretty rich plan. So as the name says, primary choice, it is designed around primary care physicians, which also means it is narrow on the PCP. So that's one thing I want to point out. The PCP for this plan is narrow. Specialists and hospital is our full HMO network. So please check their PCP before selling this plan. This plan does include the travel benefit to Arizona, Florida, Texas, and out of service area Michigan, which is kind of like Traverse City and so forth. We do include preventative dental, vision, hearing, fitness, just like our other plan I just talked about. It does have the tier 1 and tier 2 $0 copay for 90-day mail order. It does have the $0 vaccines. This plan used to cover tier 1 and tier 2 drugs in the donut hole. That is no longer the case, so please note that. We'll be talking about the donut hole in a couple minutes on our plans, what we're doing. This plan, because it was designed by doctors and they want to coordinate that care and work a lot more closer with their members, they are requesting referrals. So this plan does request referrals. As you can see, the plan is pretty rich because it's narrow on the PCP, so we are able to make the plan a lot richer. So you'll see there, inpatient hospital is only $235, which is very low compared to all the other plans out there. This plan also has no limit on worldwide emergency coverage. Almost all Medicare plans limit you to $50,000 for worldwide emergency coverage. This plan has no limit. 019, this is our medical only plan, another successful plan for HAP. This plan works very well for veterans and people that are on original Medicare. So you're on original Medicare, you don't want to pick up a prescription drug plan, and you're nervous about paying that Part D penalty. This plan is perfect for them. It'll help them with their original Medicare. It gives them $50 per month on a Part B rebate. So every member that buys this, including veterans, people on original Medicare, or anyone else, they automatically get $50 off their Part B. So that's why a lot of agents work in that veteran community. A lot of them have Part B and they're just using the VA hospital system, so they don't pick up anything else, they might as well pick up this plan. They get $50 a month off their Part B, plus they get all the extras, including preventative, dental, vision, hearing, fitness, over the counter. So this, if you look at the benefits there, it also is an extremely rich plan. So you talk to the veterans, they're like, well, we're using the VA hospital. Well, you know what? This gives them a second option. I mean, a $0 PCP, $20 specialist copay, $0 PT, OT, ST, and labs. It's a no-brainer for them to pick up this plan. Henry Ford tiered access is our narrow network Henry Ford plan. It's got a $95 premium. We don't sell a lot of it anymore because most consumers have moved to buying $0 plans. POS, if you've heard my pitch before, not a big fan of POS. I call them for what they are, POS. The reason I say that is they get agents and consumers in a lot of trouble. And basically, this is my theory: is if you want an out-of-network benefit, buy the PPO. If you don't care about the out-of-network benefit, buy an HMO. Don't sell in between. It's confusing. It will get you in trouble. Try explaining on a POS plan how there's no MOOP. And if you go to Cleveland Clinic, for instance, you think you have a travel benefit or a out of network coverage. Well, since there's no MOOP, you could spend $50,000 out of your own pocket. So I do get concerned with agents selling POS, and I don't really talk about them. We do have two plans. I will let you review them if you're interested. They are really rich on the copays, richer than any other plan we got out there. Just be careful selling them. Our PPO plan, I love our PPO plan. So we've had a very successful PPO plan the last couple of years. A lot of our competitors have copied our plan, including that green and blue company, which is funny. They're copying us for once. The one thing we had to do, though, as we heard from agents, is, you're a local company. You have your hospitals and doctors in Michigan, but when people are buying a PPO, they want a national network. So what we did for 2021 is we did take our travel benefit that was on our HMO for the last couple of years. We added it to our PPO, but we made it 49 states. So at this point, our PPO basically has a national travel benefit. They can go to any doctor, specialist, hospital that accepts Medicare, and everything's covered in network. So someone asks, why do you list 49 states? What's the other state? Well, the other state is actually Michigan. So in the state of Michigan, you are covered in network if you use the in-network doctors and hospitals. If you go out of network only in Michigan, that's when the out-of-network benefits come into play. Once you leave Michigan, everything is in network. You can see here, it does include, like I mentioned, all the other plans: preventative dental, vision, hearing, fitness over the counter, 2 preventative dentals, 90-day mail order for $0 copay, $0 vaccines, $0 PCP, $0 mental health, $0 telehealth. So extremely rich benefit. It's one of the only $0 PPO plans out there that has a Part D deductible of 0 for all tiers. You also notice inpatient hospital, $295. I've seen the other PPOs out there. Most of them are $325, $350, $390, and that was a huge pain point for members when we interviewed or surveyed them. We have another PPO. We actually have 4 PPOs total. This is our $60 premium. Again, higher premium, richer benefits. West Michigan. As I mentioned, we have been very successful in West Michigan. We partnered with the Mercy Health System, and this year they actually mentioned they're actually dropping the Blue Cross plan as a narrow network. So we will be having an exclusive narrow network with Mercy Health. Huge opportunity for us. As I mentioned, we've seen a lot of agents write a ton of this plan because it's extremely rich. So if you do write clients in Grand Rapids, Muskegon, Oceania, you're definitely going to want to check out this plan because it is so rich. If you look at the benefits on the next slide here, there we go. You'll see it's a $0 plan. If you look at the benefits, it's, like I mentioned, very rich. It's available in 4 counties: Kent, Ottawa, Oceania, Muskegon. It is a narrow network, so they do need to use the Mercy Health System. It does include the travel benefit: Arizona, Texas, and Florida. It does include all the extras: dental, vision, hearing, fitness, over the counter, 2 dental exams, tier 1, tier 2, 90 days at a $0 copay. This plan actually does cover tier 1 and tier 2 drugs through the donut hole at a $0 copay. We do have the $0 vaccines. We have no referrals on this plan. If you look at the benefits, it is extremely rich. $0 copay, no medical deductible, inpatient hospitals $235, PCP is 0, ER is inclusive. Labs, PT, OT, ST is all a $0 copay. Therapeutic radiology, $25. One thing we heard from agents is the only thing you're not having on your plan is that radiology at 60. We lowered it to 25, and no Part D deductible. So sorry if you hear my son in the background. He's talking and watching a movie, so sorry about that. Other plan we have is our $30 premium. This, again, a little bit more premium, gets the copays down, so a little bit richer plan. D-SNP. As I mentioned, we are expanding our D-SNP. I do see a little issue there in the wording, but for our D-SNP, it is expanding. It'll be in Macomb, Oakland, and Wayne. We currently are in Genesee County. It does include our full HMO network. So huge network. I know a lot of D-SNP are missing some of the doctors, especially like the Henry Ford system. Not too many D-SNPs include Henry Ford. For our plan, you must be full dual. So you must have QMB plus, SLMB plus, and FBDE. I will note on the HAP certification on Miramar, it asks about this and it only gives you the answer of QMB plus. That is the correct answer, is QMB plus. However, the plan does accept QMB plus and SMLB plus. We do include 24 one-way transportations. We give them a $2,000 benefit through Delta Dental. However, it does not include dentures, bridges, crowns, and onlays. Medicaid actually picks that up in most cases. We do also give them a $200 vision allowance, a $1,000 hearing allowance. So it is a very rich benefit. Because they are full dual, you'll notice there's a $0 cost share on everything. One thing I want to mention is we've done a lot of research on the D-SNP, and D-SNP actually, when it comes to Michigan, is quite far behind the national average. When it comes to D-SNP, we're kind of one of the last states to start introducing it, and you're seeing this year especially a lot more plans coming out with it. Last year you saw a couple new plans, so you're going to see a lot more talks or meetings about D-SNP as we go forward. One thing we did notice about D-SNP is they look really good on that outside book cover. So you're seeing a lot of these national plans coming in with these very rich benefits. However, if you look at the retention on D-SNP, it's horrible. And the reason for that is the members go to use the plan and then they realize, oh, this is what I actually have. And so we actually spent a ton of time doing research on this, and we actually hired someone by the name of Christy Strain. She actually started 5 D-SNPs for those national carriers across the country. Probably one of the most versed person when it comes to the D-SNP. So we did hire her, and she's actually been working with us to help design our plan and actually kind of make recommendations on where we want to go. And one thing we found out is based on her recommendations is you got 2 options here. You can either make the outside cover look really nice, or you can make the inside cover look really nice. And when you're talking the D-SNP community, they are usually obviously lower income. They usually have more medical problems, and they need a lot more hands holding. So we decided, because we are a not-for-profit company and don't have to worry about shareholders, we're going to focus all of our attention on, once we get the client as a member, is that hand holding. So all of our members are assigned an individual person to talk to. We work hand in hand with them, and we're here to help them. So you're going to find that, we don't have the $2,000 over-the-counter benefit or the $5,000 dental benefit, but our members are going to stay with us once they buy HAP because of that hands-on experience they're getting, the calls that we reach out to them and ask what we can do to help them. When COVID happened, the clients we have in Genesee County, we actually called every single one of them. How can we help you? Do you need help getting to the grocery store? Do you need help picking up your medications? So that's what's going to separate us. And one thing as agents you need to know is, no, we're not extremely rich on the outside benefits, but once they become a client, they will not leave. Pharmacy benefits. So again, we do have one of the richest pharmacy benefits out there. If I can get it to come up. It looks like, Christy, this is blank for some reason. So I'm just going to kind of talk through this slide. Hopefully. Let's see here. I think they're all blank. Okay. So we're missing some slides here, but I will walk through them. So when it comes to our pharmacy benefits, because this is extremely important, we do have one of the richest pharmacy benefits out there. So the first thing to know is that on the Grand Rapids plans, I did mention we do cover tier 1 and tier 2 drugs through the donut hole. We used to do it on the primary choice plan. That is no longer the case, and I'll talk more about that in a second. For the plans, I also mentioned we do cover tier 1 and tier 2 drugs at a 90-day mail order supply, $0 copay. It's through Pharmacy Advantage. So this is very important for your members to know. We also have a very comprehensive formulary. We have a team that all they do is investigate drugs as they come out, FDA approved. So we spend a lot of time on that. We also work very closely with our members to make sure they're on the prescription that makes the most sense for them. We have a medical team that actually works on this through Henry Ford. So a lot of times you'll find that companies just push generic drugs, and sometimes it's not the best, and sometimes it is for the client. So we actually have a pharmacy team and doctors that kind of work this. When it comes to our formulary, like I mentioned, we're one of the richest out there. I would put it hands down to any company. Some of the things that we do a little different is we actually cover some brand name drugs as a tier 2, which means 90-day mail order, it's a $0 copay. Drugs such as Novolin, Novolog, Lantus, ProAir, which are very common insulin drugs. ProAir is an inhaler. Again, covering those at a tier 2. We also cover drugs which most carriers will cover at a tier 4 or 5 at a tier 3, such as Breo, Restasis, Advair. So again, very rich pharmacy benefits. I wish I could show you this next slide because I'm really excited about this thing we're doing, is the Part D senior savings model. So you might hear that a lot of companies are participating in the Part D senior savings model. What this is CMS came out with a new law that is optional for carriers to participate in, which allows for us to basically cap insulin cost at a $35 copay through all Part D phases. So what we've seen our competitors do is say, okay, this is optional. We'll allow you to do this on certain plans. And I think that's a huge disservice to your clients, to agents, because it makes it confusing. We actually at HAP have decided to put the Part D senior savings model on every single one of our Medicare Advantage plans. So all of our Medicare Advantage plans, except for D-SNP, because that follows LIS rules, but all of our Medicare Advantage plans will have the Part D senior savings model, which means insulin for diabetics or whoever else is on insulin, it's capped through all Part D phases, all plans at $35. This means like Novolog or Lantus, we cover that as a tier 2, which 90-day mail order, it's a $0 copay. You hit the donut hole currently, you might pay $150, $200. Next year, you'll be capped at $35. Toujeo, tier 3, you're going to pay a $10 copay. You hit the donut hole, you're capped at $35. This is very important. And I think the nice thing with HAP is we're probably the only carrier out there that actually put it on all of our plans. The other thing I kind of mentioned when it comes to pharmacy benefit is the tier 6 vaccines. First carrier to do this. We are actually covering almost all vaccines that are picked up in the pharmacy because it's a Part D benefit at a $0 copay. So this includes vaccines such as shingles, hepatitis A and B, measles, mumps, rubella, meningitis, all at a tier 6, all at a $0 copay. So we are really excited about that. Supplemental benefits. I think this is going to be blank also. Yes. So let's talk about supplemental benefits. So some of the other extras that we include on our plans is we have preventative dental. This is through Delta Dental. All of our plans include 2 visits. You get 2 exams, 2 cleanings. You get the brush biopsy. You get the annual X-rays, all at a $0 cost share. It's through Delta Dental, which is the largest network out there. For Delta Dental, we actually include their PPO and Premier. I'm seeing a lot of carriers that are only including one of those. We have both. Vision. We have expanded our vision benefit. So previously we were not through IMED. We had basically had our own network, and as we expanded into new counties, there was some gaps there. We now include IMED. So it's one of the largest networks out there. They have their online retail and brick and mortar. So really excited about this. We're giving $0 exams and $125 benefit. Most carriers are 100, so we're doing 125. We do have the hearing aids, 2 hearing aids per calendar year covered at a flat copay. There's 4 levels depending on the technology. We have the over-the-counter benefit through Convey Health. So OTC benefit to Convey. Our plans include $45 to $100 per quarter. It's a mail order program. They send it in, they can order online or call, and the stuff is shipped within 5 days. Telehealth. Sorry, you can't see this either. Our telehealth benefit, we do include that on all our plans, which also includes behavioral health. We are actually adding dermatology this year too also. We do talk about the visitor travel benefit. So as I mentioned, HMO is Texas, Florida, Arizona. PPO is basically national. We include Systemerica, which is the worldwide travel benefit. Gym membership. I'm really excited about this gym membership, and I'm just kind of spend some time talking about this. So when COVID hit back in February, we started doing a lot of research on the gym membership. When it comes to Medicare Advantage plans, every plan has a gym membership. So clients really don't look for it anymore. They don't talk about it. However, when COVID hit and all the gyms got closed, people started talking about it. And so we started doing research and kind of noticed that the silver and fits, the silver sneakers, they weren't like changing at all. You can't use your benefit, but we're not going to change. And so we decided to kind of do a huge investment into this. And we found a program that was extremely innovative when it comes to gym memberships. And it's called PureFit Move. And PureFit Move, what I mean by innovative is they have all the national chains. So first off, we're probably one of the only carriers that will cover Lifetime or Orange Theory as a gym membership. So our clients can go to Lifetime at no cost. So the way it works is you get 32 credits per month. You can use those credits for a gym membership monthly, like I mentioned, Lifetime, LA Fitness, Planet Fitness. You can also use those credits for a studio classes. So that's one thing that's very innovative is they have studio classes such as like Pure Bar. You're not going to see that also in other gyms. And then virtual classes. So they have online classes, which right now is huge. So one thing we made sure is that this program would have a ton of online presence because of COVID and not knowing how long this was going to last. You can also get like with the virtual classes, you can get like yoga mats and stretch bands and a fitness band, like the Apple Watch and stuff like that. So really excited about this program. Very innovative, and I think that's what's going to separate us. So now you can actually say, hey, HAP has PureFit, which is going to separate us from our competitors. They can go to Lifetime for free. Other programs. So as I mentioned, again, not being traded in the stock exchange, when you're looking at plans side by side, I tell you to read those summary of benefits details because that's where you're going to find all the hidden things which separates us versus a stock-owned company. So our plans include Mom's Meals. So this is a delivery program for chronic conditions once they're released from the hospital. For like heart failure, diabetes, they get 28 meals, which is a 14-day supply. Our plans include Livongo, which is for diabetics. Extremely great benefit for those people on diet that have diabetes. We've actually seen decreases in numbers and decreases into hospital admissions because of diabetes because of this program. So we love Livongo. We push it very hard. Our clients get unlimited free strips. They get a new free smart glucometer with this. We also give $0 podiatry exams. For 2021, we are also adding acupuncture, so they'll get 20 visits at a $0 copay on most plans. It is for chronic low back pain, and it is, I think, 20 visits. Healthy Living Rewards Program, we do have gift cards for our members just for getting mammograms, colonoscopies, so those preventative tests done, they get a gift card. We also have nutritional counseling. So those people that need help for nutrition when it comes to medical illnesses at no cost, smoking cessation. So if they want to stop smoking, $0 cost. We also have low copays for pacemaker testing, peripheral vascular disease testing, home health services, $0 copay, opioid testing. So again, very rich benefits. Buy-up dental. We also include our buy-up dental. We have two options, Delta 50 and 70. Again, we actually have three options. Delta 25 is a new one, not a big fan of it, so I kind of stay away from it as agents. I like Delta 50 and 70. This gives you an $800 or $1,500 max benefit. It covers everything, including crowns, bridges, dentures, and implants, and it covers everything with no waiting period. So very rich dental. As I mentioned, it's the PPO and Premier. One thing you'll notice about the Delta 25, this is our new one, which does give members $2,500 benefit. However, the coverage is only 25%, so clients paying 75%, and it doesn't include bridges, dentures, and implants. So a little concerned about that. So I would recommend Delta 50 and 70. For Medicare Advantage, we do pay the CMS max commission, so $539 and $270. We also are giving a $100 certification reimbursement. So if you write 10 new for 1/1/21, you'll get a $100 reimbursement whether you take Pinpoint, AHIP, or Miramar. VBE, value-based enrollment. I am really excited for this program for 2021. So one thing we currently have to do every single year is send out a health risk assessment to the members. And what this does is help us coordinate care with the members. So they complete the survey, we get it back from them by mail. And then this gives us a lot of data regarding the client to more coordinate that care. It also helps us for star ratings. And we've noticed recently, especially with COVID, that members are not filling out this HRA form, which means we cannot really coordinate the care with them or help them out. And so we are switching to doing a online VBE. It's through the Ascend platform, which is our online enrollment tool. At the end of the application, you'll be asked if you want to complete the VBE. You can either click yes now or in the future, and you can schedule a date. The member at that point will get a call from our call center, and they will ask them the survey questions, not you. You're just initiating it. The member actually gets the call, and they'll be asked to complete basically it's about 10 to 15-minute survey. And then once they complete it, you will actually get a $50 service fee for your member completing this call. So every one of the VBEs your members complete, you get a $50 service fee. So it's an additional way for you to earn revenue. We are really excited about this, and this is for Medicare Advantage. Let's talk about Medigap plans. We have made a huge investment into our Medigap plans, and I think there's a missing, yes, there's a missing slide here, so I'll just kind of read through it. Give me 1 second, I want to make sure I don't miss anything because this is pretty important. So for Medigap plans, we have plans A, C, D, F, G, and N, so all your main plans. We do guarantee issue on all plans for new to Medicare or turning 65. Commissions are the same. For loss of coverage, we do plans D, and C and F. So loss of group coverage, we do plan D, C, and F. We do not do plan G and N. And the reason we do that is we want to keep that risk pool for G and N very stable. So if you have someone that lost group, you can enroll them in our plan D. As you know, with macro rules, C and F, you can no longer sell to people if they're new to Medicare after 1/1/20. Our plans are portable, which means if you leave or move Michigan, you can actually keep your plan and we don't change the rates. One of the few carriers doing that. We do give our members a household discount. So if there's 2 people living in the same household that enroll with HAP for Medigap, they each get $10 per month off their Medigap plan. So it's $10 per month per member. New this year, really excited for this, and this is what's going to separate our Medigap plans from our competitors, is we are actually adding our PureFit Move gym membership to our Medigap members at no cost. So our members can actually go to Lifetime with their gym membership at no cost. So the same Medicare Advantage gym membership I talked about, we included with Medigap, one of the first carriers doing this, and I think this is going to separate us. We also are giving our Medigap members the option to buy up dental. So the same 2 dental options I had mentioned on the previous for Medicare Advantage will be available to our Medigap members. So you have the $23 premium or $44, giving you an $800 or $1,500 benefit. One of the few Medigap dental options, no waiting periods, any services, including bridges, crowns, dentures, or implants. So our members get the PureFit gym membership, no cost. They can have the household discount, $10 per month. And they can add optional dental if they choose. Premiums, we are extremely competitive. So you can actually sell a Medigap plan anywhere in Michigan. We have the same rates for the whole state. If you look at our rates here, just a quick glimpse, you can see our plan G is $130 for a male and $121 for a female. This does not include the household discount, which makes us $120 and $111. I've seen our local competitors here in Michigan, and we are one of the lowest when it comes to Plan G. If you take into consideration all of the extra benefits, I think you'll have an easy time selling our plans. I have some of the national carriers. I know they're a little bit lower. Obviously, you add the household discount, you add the gym membership, the optional dental. I think that's important. We also don't pool our rates. So this is extremely important to know, is your nationals pool their rates. Again, have to have that huge margin for their shareholders. And pooling rates basically means is after usually 5 years, they'll transfer a pool on, which allows them to raise the rates on that pool without impacting new people. So a different way of doing sales with HAP, when say for instance, a person's been with us 10 years, they're now 75. You can look at the new rates and you can look at your existing members, and a male 75 will pay $183 if on Plan G. So we don't transfer risk pools, which means when we come out with new rates, they impact everyone. So that is really important to know. It also means your rates are more stable. When you do risk pools, you're able to have 20% rate increases on a risk pool because that's not your new members. So I think that's really important for agents to know when it comes to Medigap. Compensation, we are very lucrative when it comes to compensation. So plans D, G, and N, which are the main ones you're selling, we pay $250 10 years, so over a 10-year period. We're paying $2,500, which makes us one of the most competitive when it comes to commissions. We don't really pay an A, C, or F. $150 for 3 years. We really don't want you selling those. So I had some agents say, you know, we're not seeing Medigap clients stay on the books like they used to. Average right now is about 5.5 years. So we actually this past AP I saw the largest switch from Medigap to Medicare Advantage we've ever seen in history. So we are seeing a lot of people move, which means, yeah, we pay over 10 years, but your clients probably won't stay with us for 10 years. They'll probably switch to a Medicare Advantage at some point. So I am really excited to announce, and you can't see it, our incentive for next year. So for next year, 2021, we are introducing a Medigap bonus program. We'll have 3 tiers. It'll be a quarterly bonus. So at level 1, if you write between 3 to 5 Medigaps in a quarter with HAP, you'll get an extra 150 per app. If you write 6 to 10 with HAP Medigaps per quarter, you get 200 per app. And if you write at level 3, 11 plus Medigaps a quarter, so that's basically say 4 a month, you're going to get an extra 250 per app. So you're basically making 500 in first year commission. So probably one of the most lucrative Medigap commissions. So if you look at our Medigap plans, we have low premiums. We give you a gym membership. We actually have Assist America on our plans. We give you the optional dental. We have consistent rates. We have one rate for the whole state, so you don't have to try figuring out what territory they're in. And we're very lucrative when it comes to agent commissions. So I am very excited about our 2021 Medigap plans. I'm going to skip a few slides here. Get to supplies. So ordering supplies with HAP. So this year we've decided to make a huge investment into our online enrollment tools. With COVID, we feel like more agents are going to turn to online, probably not run as many in-person meetings. We're also expecting that there probably will be some guidance from CMS at some point about doing in-person meetings. So we decided to spend a lot of money on the online enrollment tools. So we're going to have kits available, paper kits. We're just going to try making them. We're just going to try to limit the number of kits that we send out this year and focus on the online tools. For agents that wrote 5 HAP apps this last AEP, so for January 1st, 2020, you wrote 5 or more Medigap, MedAdvantage, you're automatically going to be sent a drop shipment of kits as long as you update your address on the hapagentportal.com site. So you'll get a drop shipment of kits, kind of like a starter packet. You'll get a little bit of each kit to help you get going. You'll have those in your hands by 10/1. If you need more kits, you can go in there into the system after October 1st and request more kits. If you're either new to HAP or didn't write any last year, but not that many, you will be able to go into the system that 3rd week of September and request additional kits. And you will have them in your hands as long as you do it before that around that 3rd week of September. Watch an email we will be sending out regarding this. You will get them in your hands by October 1st. Again, you go to hapagentportal.com to request those kits, and they will be available for order, I think that 3rd week of September. Online enrollments. So I am really excited for our online capabilities this next year. As I mentioned, we made a huge investment into our online enrollment platform. We use the Ascend tool. And so you're basically going to have 3 options to do enrollments with HAP. First way is paper apps. So you can email, fax, or mail those in. I'm telling agents not to use paper. And the reason, one is they get lost by fax or email or mail. They get lost sometimes. 2, we have a hard time reading handwriting, or the people keying in the apps key them incorrectly. So you have high chance of errors, and there's a significant cost to them. We are recommending that agents use the online enrollment tool Ascend. There's 2 ways to access this. One is you go to hap.org. You can do online enrollments right through hap.org. You don't even have to log in. You just put in your agent information at the end. However, there's no way to track your apps by doing that. You won't have access to the VBE, the value-based enrollment tool, for the extra $50. So we are recommending agents download the Ascend tool. If you don't have access to the Ascend tool, you can email Jason, and I'll give you his contact information on the last slide here. But download the Ascend tool. You can download it on a Microsoft laptop or iPad. And what the Ascend tool is going to give you is a lot more access. So I'm going to kind of go through what everything it's going to give you and why you should be using Ascend as an agent. So first off, the Ascend tool allows you to text or email scopes. So one of the big things is you probably won't be doing a lot of in-person meetings. You still need to get those scopes signed. So how do you do that? Well, you can text and email a scope and get signed that way. So don't even need to see the client. When you're going through an application, you're probably wondering about their LIS level, which impacts their prescription costs. Our system, the Ascend tool, will actually check their LIS level. So it'll tell you whether they're 1, 2, 3, 100%, and so forth. You can get the drug breakdown. You can look up pharmacies. You can check doctors to make sure they're all in network. All of our agents that use Ascend also get a Pearl, which is an individual hyperlink. This is the best part of the system. So as an agent, you get this individual hyperlink. You can post that hyperlink to your website, to your social media, Facebook, LinkedIn, Twitter. If a person clicks on it and enrolls, you get paid. So if I was an agent, come this AEP, I'm going to do some Facebook marketing. I'm going to say, hey, Medicare is here. Change your plan, pick HAP. They click on the link, they enroll, you get paid. You don't even have to do anything. The system also this year we're introducing will have a quick sign application. So say for instance that you're doing a telephonic enrollment. One thing with doing telephonic enrollments, you have to record the call to be in compliance with CMS. However, most agents don't have access to a recording system and it's expensive. So a way around that is you have the members sign the app. So I heard a lot of agents saying, well, I'm going to use DocuSign. Well, you know, that's great, but you have to get that all CMS approved. And I guarantee you probably don't have the process in place to get that done. So we are actually making it through Ascend. We're making it like almost like DocuSign. So basically what will happen is you're on the phone with a client, you pick the plan, you start the application. At the end of the application, you click send for signature. The client's going to get 2 emails, one with a code because you had to be HIPAA approved. They put in the code into the other system, the other email, and they can sign the application. They hit sign, they type in their name, they're done. You don't even have to record the call now because the member has signed that application. So I think this is huge. I think this is a ton of value to you as an agent, and I would expect that we're going to probably do a lot of sales just based on that system. The other thing, let's just say, for instance, like individual health, you're going through it, and the client says, well, send me some information. I want to look at it. Well, most of the time now you email them an application and a summary of benefits. They look at it and nothing ever happens. Well, what you can do with this system is I can say, okay, I want to send them the HMOR PPO. I click 1 plan or 2 plans or 3 plans. I can do a comparison side by side. I email it to the client. They then at that point can click the plan they want. They can click enroll, complete the application, you get paid. So if you don't have access to Ascend, you should. I think every agent should use this platform. It helps you from a compliance standpoint, and I think it's going to make your life a lot easier. Once you get good at the system, you can actually do an application in under 2 minutes. We are going to have some upcoming trainings. We actually have one on Thursday, so that way you can get more training on the Ascend. If you need help, you need access, email Jason, and his contact information is there, and it will be on the upcoming slide. Certification, almost, oops. So certification. So again, blank slides. So I make sure I'll get you the PDF copy to Christy of all these slides. So you have every slide. But certification requirements. This will basically complete your online webinar attendance for doing this, but you still have to go online and do the Miramar test for HAP products. So you're going to go to www.miramar agent.com. Once you're in there, you'll upload your pinpoint or AHIP certification, and then you'll take the HAP product test. Hopefully everyone passes at 100%. Once you pass the test, you are good to go. You will get a ready to sell email. We send those out twice a week. And then also we send it to IAD so they can check that for you too. We're going to have additional training because we are launching so many new things. We want our agents to be experts when it comes to the HAP products. So we are going to have a DSNP expansion meeting coming up in the next couple of weeks so you can get additional information on our DSNP plans, everything you know about DSNP versus MMP, Medicaid, how it all works. Christy, our Medicaid/DSNP expert, will be doing these. We're going to have some training on Ascend, so how to do the online enrollment tool. We're going to have meetings on our supplemental vendors such as PeerFit, iMed, Delta Dental, Convey, Nations Hearing, and Livongo, and so forth. So really excited about those extra meetings. Contact information. So I didn't mention this in the beginning, but I am really excited that Jason Glutzner has kind of taken over Kevin Cox's role. So a lot of you probably talked about Kevin in the past. He actually decided to go the agent route. So really excited for him. I think he's going to do very well. Everyone loved working with Kevin, and he's just a great guy. So, but I am excited for Jason. So Jason's been with HAP since 2014. He's actually been in the business for 14 years, was an agent himself, worked heavily with HAP on the Medicaid side, so he knows that market. And then he actually was the one answering calls and emails for the last couple of years on the HAP producer line for Medicare. So ton of background in the Medicare space. Really excited to have him on board. There's his email and cell phone. And then myself, Dustin Medine, I run the sales for HAP. There's my email and cell phone. One thing I want to tell agents is we want your business. We want to partner with you. We are a text away. So if you ever need help, you have a question, you're sitting with a member, you need help, text us both. We're pretty quick at responding. I respond to my text. It's usually sitting in front of me, I think 24/7. So we do respond very quickly, but we want to be that resource for you. We want to be help for you. So whatever you need, just let us know. We also have our general questions inbox and phone number. So if it's not urgent, you can always email that line or call them, and they're there from 8:30 to 4:30, and they'll be to answer your questions. Commissions contracting, I would usually recommend that you go through IED. So if you do have commissions or contracting questions, I would start there. We don't want to mess things up on the contracting side. Work with them, and then if you need additional help, you can also reach out to Stacia, but definitely start with IED as your main source for contracting or commission questions. So I'm going to leave this slide up. At this point, I don't have any additional information. I will email Christy the PDF of these slides. Christy, is there any questions for me that you can see?
I'm looking at questions, and feel free to just type them in the chat feature. But currently, I am not seeing any questions. Thanks, though, Dustin, because this is just great information, and we're really excited to see this year's plans. You had great plans last year and didn't think you could top them, but you guys did. So we're really thrilled. And let me just double check on chat. No questions, which that can be a good thing. So,
Perfect.
right. But I'm sure I'll be reaching out to each of the attendees, and feel free to contact us or HAP and the representatives at any time. And so thanks for your time, Dustin. We really appreciate it.
Thank you. Have a great day, everyone, and we look forward to partnering with you through this AEP.
Us too. Thanks so much. Bye.
Bye.